Hey guys, Dr. Berg here. In this video, we're going to talk about how they diagnose something called ADHD, Attention Deficit Hyperactivity Disorder. This is really a complete joke based on all subjective findings. There's no objective anything. It's a bunch of psychiatrists in a room that vote on this, but check this out. This is how they would diagnose a second grader, okay? Has trouble getting started on tasks, getting dressed, putting away toys, ignores directions, or delays in following directions, hard time sitting during meals, fidgets, talks when they're expected to be quiet, has trouble stopping one activity to begin another, struggles to slow down enough to do things carefully, needs to be reminded a lot to stop and listen, has a harder time paying attention, grabs things without permission, is unable to wait for directions, takes too much time to complete tasks, has trouble remembering directions, has trouble recalling facts they just learned, very upset or annoyed over minor frustrations. These are all normal things, normal behaviors for a second grader. And as soon as they label them, that's one thing, and then they just put them on a drug. This is a great book called The Hyperactivity Hoax by Sydney Walker, MD. I mean, it's all about keeping kids quiet, stopping them, slow down, stop, wait. I mean, this is going to mess up a kid if we keep stopping them, and like have this quiet child that is supposed to be normal. And then there's just one little point I want to mention with hyperactivity. Often fidgets with hands and feet and squirms in the seat. Often leaves the seat in a classroom and other situations when they're supposed to be sitting. I mean, you try to take a child and put him have him sit for long periods of time, it's not natural to do that. Often runs about and climbs excessively in situations which is inappropriate. Often has difficulty playing or engaging in leisure activities quietly. How are you going to play with something quietly? It's a joke. Often on the go, and often acts if driven by a motor. I'm serious. That's one of the criteria. Often talks excessively. What if they're social? Listen, all these behaviors are normal for a child, and this is the biggest scam, a hoax. These kids, I know their nutrition could be improved. They never look at the diet. They never look at the nutrition. There are minerals in the body and vitamins that slow the motor down, that get a child to be more calm, okay, if it's excessive. B1 is the #1 thing. Get a natural B1 from nutritional yeast. Mix it with, even if you have to add a little bit of low sugar chocolate with peanut butter to get the child to consume it with some nutritional yeast, or put it in applesauce, get the B1 in their nutritional yeast. That will chill out the child like that. Of course, got to get them off the sugar. Unfortunately, a lot of parents start the kid on sugar. We don't want to do that. We want to not have sugar in the house. But I have a lot of recipes. I'll put a link down below of all these great foods. If you're a parent, you need to start making these for the kids. They will not know the difference between a low-carb treat and a sugar-filled treat. It's like way, way better, and it's healthier. Potassium. We have to find a vegetable that they like. Do the kale shake and put maybe bananas and fruit in there so they don't taste the kale, and have them consume it. That will give them so much potassium, you'll see the child will have more control of their own body. But this out-of-control situation is purely physical. It's not a mental problem. Preservatives, they could be allergic to something in some chemical. I mean, the amount of all the junk food has MSG, it's a neurotoxin. And magnesium, that's in the vegetables. So these two minerals are brakes on the nervous system. They calm the nervous system. I will guarantee doing this simple thing will probably handle near 100% of these kids with this so-called disorder, okay? Put your comments below. Hi guys. Hey, listen, I created a pretty amazing evaluation quiz down below that actually analyzes your symptoms to find the cause, the root cause of all of your symptoms, the most likely cause. So take the quiz now, and we'll send you a report.